It's live.
Namaste. A very warm welcome to all the viewers. Welcome to this AMA, the Ask Me Anything session, a quarterly program hosted by Vivekananda Health Global. Today's session aims at spreading the science of yoga therapy so that the right knowledge and understanding reaches the mass. I'm Dr. Vasudha M. Sharma, the Director of Medical Services, Vivekananda Health Global, that is VHG. I welcome all the viewers once again, and let me begin like this. See, on October 11th, 1968, NASA launched Apollo 7, the first successful manned mission. On October 11th, 2000, NASA launched STS-92, the 100th space shuttle mission. So why am I talking about NASA? It's just to create a simile. NASA needed a launch pad to achieve these milestones on October 11th. And today, October 11th, we are going to talk about the launch pad of all the activities happening in the human body. That's our brain. But mainly about the problems related to it and how yoga is highly beneficial in the management of different disorders. So today we uncover the benefits of yoga therapy in neurological conditions with our experts. I welcome our eminent experts and thank them for taking some time out to join us. Dr. Praveen Thomas has joined us from London, UK, but apparently presently in Kerala. Dr. Sanjay Raghav from Melbourne, Australia, and Dr. Manjunath NK from Bangalore, India. So I welcome you all once again for the Ask Me Anything session of VHG. So just a brief about VHG. VHG is a pioneer in the field of integrative medicine, combining Ayurveda, yoga, and naturopathy for the complete mind, body, and spiritual well-being. With the headquarters in Bangalore, VHG centers are spread across in India at Guwahati, Hyderabad, Kolkata, Mumbai, Trivandrum, and overseas at Shanghai, Seoul, and New York. With this brief, it's now my pleasure to introduce the experts or the panelists of today's session. Let me take this opportunity to introduce Dr. Praveen Thomas, who is based in London, UK. He completed his post-graduation in general medicine and chose neurology as super specialty, has worked for 2 years in neurology before joining the Diplomat of National Board Higher Specialist Training in Neurology from Amrita Institute of Medical Sciences, India. He then passed postgraduate diploma in clinical neurology from Queen Square and Diplomat of European Board of Neurology. He has also completed a 1-year clinical fellowship in headache from Queen Elizabeth Hospital, Birmingham, UK. He is the founder trustee and treasurer of the Asia Pacific Headache Society. He is also a reviewer of the American Headache Society's journal, Headache, and the chief of headache section of the journal on recent advances in pain. He is a clinical teaching fellow at Queen Square Institute of Neurology, United Kingdom, and he continues to teach and publish in general neurology and headache medicine. Thank you, Dr. Praveen, for joining us. I welcome. Namaste to you.
Namaste to you and everyone else. Thank you very much for inviting me to this very wonderful meeting of all of us. Thank you.
Thank you. So the other expert of the session today is Dr. Sanjay Raghav, who has joined from Melbourne, Australia. It's a little late for him, but I thank you, Dr. Sanjay, for joining us. So a brief about Dr. Sanjay. After completing his undergraduation and MD in medicine, Dr. Sanjay completed his DM in neurology from Lucknow University and later his FRACP from Royal Australian College of Physicians in 2006. He has also completed his fellowship in movement disorders, and a feather on his cap, he's certified yoga and meditation teacher and has also completed the yoga instructors course program. He's the director at the Dandenong Neurology and Specialist Group for the last 9 years, managing successfully a practice comprising of more than a dozen health professionals, comprising of neurologists, neurosurgeons, psychiatrists, neuropsychologists, and allied health staff. He has developed an evidence-based outpace Parkinson's program to slow the progression of Parkinson's disease, which is taught online. So he's also an adjunct senior lecturer in Monash University, adjunct associate professor at RMIT University, and member of Movement Disorders Society in Australia and India. I welcome Dr. Sanjay Raghav to this session, the AMA session. Thank you. Namaste.
Thank you, Vasudhaji. Thank you, everyone. And I'm really privileged to be part of this group, and hope we all will do our best to help our participants.
Yeah, thank you, Dr. Sanjay. Well, the third expert and the panelist of today is Dr. Manjunath NK. Dr. Manjunath NK is a naturopath by graduation, and he has done his PhD and has worked in the field of yoga and geriatrics. His specialization is into neurology and his passion is into neurology. He has been working greatly in the field of yoga and neuro-rehabilitation for the past few years. He has accomplished himself as a very well-known personality in the field of yoga and naturopathy, has published more than 50 research papers, and is presently the director of the Anveshana Research Laboratories from S. Vyasa University. Not only this, he's an accomplished orator and a speaker at various international conferences and different other conferences organized by conventional medicine groups, and has largely participated in physiological research into yoga. So I welcome Dr. Manjunath, and it's a pleasure to have you too on the expert panel list of today. Namaste.
Thank you, Dr. Vasudha. I mean, it's our privilege sharing some little whatever experience and knowledge we have put together for a couple of years with all the viewers today. And it's always a learning process. Thank you.
Yeah, thank you so much. So not taking much time further with the introduction of the panelists, we are now aware that they have a lot to offer to the society. Let's now hear from them. And let me first invite Dr. Praveen Thomas. Dr. Praveen, in the next 5 to 7 minutes, kindly share your views on evidence-based yoga therapy in headache disorders. Over to you, Dr. Praveen.
Thank you very much. So to make it very simple, I have just 2 slides and we hope to complete that in the next 5 minutes. Firstly, when it comes to hands-on yoga experience, my experience is limited to a specific type of yoga called Kalari yoga, which is an offshoot of Kalaripayat, which is a martial arts that's practiced in Kerala. And I've been practicing that for probably about 20 years, 25 years now. This is a little slightly different modified version of what is the original Patanjali's yoga, more of dynamic postures in it because it's more of a martial art based yoga. And of course, been a little bit of initiations into Tantra yogas and different other systems which are related to Tantra. Now, here comes the important point, what I want to start off with. When it comes to talking about yoga and any medical condition, the first thing we need to define is what exactly is yoga that we are talking about. So is it the historical yoga, which has been practiced in the subcontinent for thousands of years, and which is now called this origin, very good treatise by Patanjali. And that's probably something which has been carried on through different lineages of Guru, Shishya, Parampara, and it goes on. Now, this is one aspect of yoga. And even within that, are we looking at Hatha Yoga, which is mostly the physical discipline with the body-mind benefits. And I think for all practical purposes, throughout the world, people understand yoga as a group of physical and a group of exercises which tend to have the body-mind involvement and benefits because of that. Now, the other possible questions which can be asked is, historically, was yoga practiced for treatment of a disease or was it for prevention of a disease? I understand it was mostly for prevention of diseases. The therapeutic aspects of yoga is a relatively new concept. but perhaps it's probably an offshoot or an extension of the preventive aspect. But when it comes to therapeutics, it means quite a lot, which is why we are now talking about the benefits of, let's say, yoga with headache, yoga with movement disorders. So there's a lot of things which we need to now standardize in our understanding what exactly are we delivering in terms of yoga. I mean, I'm not going to talk about all the other streams of yoga, karma yoga, jnana yoga, which is all different paths. But when it comes to yoga, which is now an internationally accepted terms, most of the time it refers to the physical culture of hatha yoga. Now, here comes the other difficult part. Yoga is also understood by a lot of people to involve certain acrobatic level of exercises, which is more of an instructor level where yoga is combined with some other terminologies, calisthenics, and then main dances, and then different variations and forms, but they are all called, still you call yoga. Now, when it comes to a therapeutic level of exercises to be prescribed to a patient, firstly, we need to have evidence, as I said, because the original yoga treatise of Hatha Yoga wasn't basically giving us, say that, okay, this is good for this condition, this is good for that condition. We need to actually build some evidence. And that's what's been happening over the last several years. So I'm going to show you two different studies here as far as yoga and headache is concerned. The first one was a comprehensive study which was done on the effect of yoga on migraine. They looked at the clinical profile and cardiac autonomic functions. And the result of the study, I'm not going to the methodology, but I'm just going to briefly tell you what exactly they came out with. So with 6 weeks of intervention of that particular exercises, which involved physical exercises and breathing exercises, probably a combination of pranayama as well as with some yoga postures, asanas. What it showed is that there was a significant clinical improvement in both yoga and conventional care group. So there were two groups after 6 weeks of intervention. And yoga therapy showed an additional benefit by reducing frequency and intensity. Now, the disadvantage of the study, that it's not randomized, there was no blinding, it was a small sample size and not generalizable. And there were many deficiencies in the study design. It was a small size. Small size is not the issue, but mainly the study design. Now this, on the right side, what you're seeing is the CONTAIN trial. The CONTAIN trial was just published about 6 months back in the month of May in the Neurology Journal of the American Headache Society. This is from the All India Institute of Medical Sciences group. So they had tried their best to make sure that the methodology is quite good. And at the same time, what they concluded was that yoga is as an add-on therapy to conventional therapy is superior to medical therapy alone, and may be useful to integrate a cost-effective and safe intervention like yoga into the management of migraine. Now, here comes a little bit of methodological issues here as well. Firstly, the advantage is that it's randomized and you had an open label superiority trial. We're just looking at superiority, and yes, they found superiority. And there was a blinded endpoint, which is also good. And it's a large RCT of 180 of patients, which is reasonably good. And they did look at validated scores for headache assessment. That is the HIT6, the headache impact test, as well as the MIDAS score. So they all looked at probably a bit of the quality of life as well. How much of this is impacting the patient and what is the benefit after doing the trial. However, there was no sham yoga arm. So that's probably a defect. So in any interventions, there should be something as far as for a medical treatment, which involves taking a pill or an injection, there's a placebo. So the placebo equivalent when it comes to a physical intervention like yoga, it's a sham procedure. For example, if it's a surgical procedure, there's a sham surgery, which is very difficult to do in practice in real life. But here, there's no sham yoga arm. What a sham yoga arm would be, let us say that they're taking 4 asanas and 2 pranayams in one group. And they think that they're building on something which somebody already did. And they're doing that. On the other hand, they're taking totally unrelated few other postures, which may not be even a prescribed asana or a prescribed pranayama, but that's a sham arm. And they were looking at the differences. Then the advantage is that you're able to say that, this particular prescribed one is superior to this benefit which was achieved in the other arm. Because what happens is that, so if you look at this other drawback, high study dropout rates, duration was kept at 3 months. For any benefits to be reasonably assessed as far as headaches are concerned, and generally for other disorders also, this has to be prolonged and it has to be assessed over 6 months to 1 year. And that's because the immediate benefits of any treatment in migraine is a placebo response. Now, an important aspect to understand is that placebo response doesn't mean it's like a inert pill, sugar-coated pill response. No, that is not the understanding of placebos. Placebos itself is a powerful treatment per se, because there is a neuroscience on how these placebos actually work. Yeah. So saying that it's a placebo effect doesn't mean that it's a dummy pill and just patients got improved. Even with that, there is a lot of factors which are coming into play. The environment it's given, the belief systems of the patient, and how it's administered, a lot of factors. And migraine is one condition where you have a huge placebo response. So 30% of patients will improve, even if it's placebo arm that you're giving. So how do we now understand whether the benefit is a substantial benefit or not in terms of building evidence? You need to show that the response has been sustained for at least 6 months to 9 months to 1 year. This is one way of doing it. And then, of course, that's the proof of concept. So this is the beginning of building an evidence. So I'll just go to this last slide of mine on how exactly can we develop this scientific evidence for yoga. It's not just for yoga, this is for any interventions, how to go about it systematically. Identify the need for an intervention. Okay, so you have identified that, okay, migraine or another condition is the medical indication. And you would say that there is a need for an intervention. That's clear. Select the intervention development approach, because how do you develop an intervention? For example, let us say you have 100 different types, and how do you develop it in such a way that the interventions that you're going to give or deliver is going to be one which is going to be effective? So you have to make some selections based on some a priori knowledge, either because of some small case series or personal experience. Then consider the needs and circumstance of the target population. And for example, the availability of that may not be there if you want to do a study, whether they're certified instructors or therapists or yoga acharyas who is going to be there in one place, very different from another country. And determine the level that the intervention will target. To what level is it going to be going for, let's say, a mild level of the disease or for a significantly severe level of the disease? Then identify the setting for delivering the intervention, whether it's going to be home-based or hospital-based. And if so, is it going to be a supervised one or an unsupervised one? Then review published evidence, which is in the existing interventions. Then draw on an existing theory or generate an intervention-specific theory, and then design the intervention and then go ahead with that. So this is how a general process of actually building an intervention for any intervention for this is taken forwards. So I'm going to just stop here because firstly, the introductory 5 to 7 minutes is definitely over. And I'll just let the other speakers also give their views on how exactly they understand the science of yoga and historical yoga and how it can be used in today's practice from a therapeutic standpoint, not just from the preventive standpoint. So thank you. Dr. Vasudha, you have to unmute yourself.
Yeah, thanks for the wonderful insight, Dr. Praveen. As you said, as doctors or researchers, we need to understand the requirement of the population and then work on the intervention too. So thanks once again. Let me now invite Dr. Sanjay Raghav to talk on yoga therapy in movement disorders.
Thank you, Vasudhaji, for inviting me. I'll just open my slides. So the topic of Parkinson's disease, I'm a Parkinson's disease doctor, which is called as a movement disorder specialist. So I just want to show you this slide first, how Parkinson's disease is being hypothesized. We still don't exactly know why people get Parkinson's disease. Not sure whether you can see my slides. I think I might need to share them first.
Please go on, Dr. Sanjay, it's visible.
Yes. So if you look into Parkinson's disease, this is a very nice diagram which helps you to understand why the incidence of Parkinson's disease is increasing. If you see in this picture, the first on the left-hand side, you can see the arborization, the branching of the nigrostriatal neurons. So to understand Parkinson's disease, this is a disease where the dopamine is less in the brain. The cells which produce dopamine are in the substantia nigra pars compacta, which is the part of the midbrain. And as these cells start dying, then there's deficiency of dopamine. So by the time 70 to 80% of these cells are dead, you get the first motor symptom of Parkinson's disease like tremors or slowness of movements. And this is a very, very highly energetic system which needs mitochondrial oxidation. So you can see in the olden times, the arborization or the branching of this part of the brain was not that much. And as the man has progressed, you can say, or maybe gone into a wrong direction in a way, that he stresses, he thinks too much, he does multitasking, and this arborization has gone much more than what it was in the previous eras. And so this area, if you can see on the right hand side, the man is using a computer. Even the paintings of these times have changed. The activity, the physical activity is less, it's more of a mental activity. So it's on its verge of system on make or break. And this is one of the hypotheses being given, that because of the highly energetic system, any tip off the balance, like, when the person is not eating well or their lifestyle is not good, they can get dopamine deficiency. Now, what is the ultimate cause of dopamine deficiency and this breakage can be multifactorial. It depends on each person, maybe the diet, maybe the gut health, it could be your genes. So we can say it's multifactorial. But the main reason is because this system is highly energetic. We have to take care of our lifestyle. The second slide I want to show you is about what the chronic stress can do. So chronic stress can lead to hippocampal neurogenesis, decrease in the neurogenesis. So that means the new cells are produced less, like brain-derived neuropathic factors. There's also stress leading to increase in the stress hormones, affecting the hypothalamic pituitary adrenal axis activity, increase in the neuroinflammation, increase in the neurodegeneration, and as I said, more of the oxidative stress. So the chronic stress is found to be one of the risk factors for various disorders, including Parkinson's disease, as the research is coming up in recent times. What is the solution for all these problems? The solution is that we don't really judge beforehand what is going to happen. As Dr. Thomas was talking about, whether we are using the strategies like yoga for prevention or for as a therapeutic. So we are here talking about the therapeutic effect of yoga, and I believe meditation is part of it. And in meditation, there are hundreds and thousands of studies which have found without doubt that, meditation decreases, slows down the brain. Even it changes the telomere effect in the brain. So there is one of the studies done on mindfulness-based intervention in Parkinson's disease, which found that in this study, there were structural changes in the brain. The parts of the brain increased gray matter density, the patients who were doing mindfulness. While interestingly, the patients who were not doing mindfulness, their MRIs revealed gray matter increased density in cerebellum, which is a compensatory mechanism in the brain when the brain cells have to compensate for the loss of dopamine in the basal ganglia. Cerebellum is compensating. So meditation has also been shown to release dopamine in this striatum. And these are the pictures. So in these pictures, you can see on the left-hand side, there is some increased activity in the basal ganglia, while in the control group, the activities are more in the cerebellar area. And meditation actually slows the aging process. And as we all know, Parkinson's disease is the disease of the old age usually. And what happens is, it's being found in studies that the telomeres, which are the caps at the end of the chromosomes, actually when it gets shorter and shorter, you are more close to the aging. The aging process is faster. With meditation, you can increase the telomere length. And this is being seen in various studies. So yoga, I call it for Parkinson's disruption. And then there are various studies, from pilot studies to randomized controlled trials. And again, the methodology used in these various studies is quite different. So you can't generalize. Some of them have used only Surya Namaskar. Some of them have used only mainly meditation with some set of simple yogic exercises. So I think we need to have a proper solid background of a structured yoga strategy, what we are going to use, and then apply on a larger population, and then check that with a randomized control trial, taking another group of patients who are using some standard therapy, and then comparing with a standard therapy like exercise, which is being found to be useful in Parkinson's patients. Now I'll end this talk with just telling you some resources which you can look through. Outpaceparkinsons.com.au is the website where there's a lot of information on various lifestyle therapies on Parkinson's disease. With the same name, there's a YouTube channel, and there's also a Facebook page. And some bookings, I'm pretty sure people are mostly in India, but you can still you look through resources on our website, goller.org. Thank you very much.
Yeah, thank you, Dr. Sanjay. I think you have done an outstanding work in the field of Parkinson's disease. Many congratulations. And thanks for sharing the knowledge. I now invite Dr. Manjunath to speak on yoga therapy, evidence-based yoga therapy in neuro-rehabilitation.
Thank you, Dr. Vasudha. I mean, it was so enlightening to listen to Dr. Praveen and Dr. Sanjay. When we talk about neuro-rehabilitation, there are so many conditions where we are interested to look at, as well as to help those individuals who are suffering from. So I'm going to give a kind of a summary of it, more or less, but I'm not going to talk too much of the scientific studies behind them. So I always looked at yoga therapy as something which can bridge the gaps in the process of neuro-rehabilitation. So if you ask me, do we have a wonderful, well-established neuro-rehabilitation program? The answer is yes and no. Yes, for certain conditions where the medical management is really good, you can revive them better and you can get them back to normalcy as far as possible. But there are so many conditions where the revival process and recovery process is hampered due to multifactorial reasons affecting them. And hence, we bring in the components of integrative neurorehabilitation, bringing yoga therapy as one of the adjuvants along with conventional neurorehabilitation programs. So this is the standard goal and aim of neurorehabilitation. multiple conditions, as I said, have something in common. Okay, so in most of these conditions, what we are looking at is bringing an integrated medical process which aims to aid recovery from an injury to a nervous system, which can be due to multiple reasons, and then minimize or compensate any functional alterations resulting from it. The main aim here is to improve functional capacity, reduce symptoms, decrease dependency, and improve quality of life. Of course, there are various attempts are being made to identify the first line of intervention. Okay, so because when you talk of neuro-rehabilitation, the source as the problems to which we can attend to can come from as many as around six different major conditions given here. It can arise from vascular disorders like be it a ischemic stroke or a hemorrhagic stroke to multiple other things. It can also arise from infections and trauma. Trauma is very well known. Of course, one of my doctoral student is presently working on spinal cord injury itself. You'll be surprised to know that in a rural India, so, particularly south of Karnataka, where at least around close to 180 to 200 people report, it seems that they have a spinal cord injury purely because of a fall from an arachnid tree or a coconut tree. So ranging from a simple injury like that to multiple other conditions which can result in brain and spinal cord injury contribute to this whole bulk of neurorehabilitation needed. And of course, structural neuromuscular disorders, multiple, including whatever we would like to really bring in, related to musculoskeletal system, related to various other structures, can also contribute to this. Functional disorders and finally the degenerative disorders can always be looked upon as the major contributors apart from the above four. Dr. Sanjay was talking about Parkinson's, while many in the same family of disorders which are degenerative in nature can contribute to it. And my special interest has always been aging-related neurodegeneration. Alzheimer's to Parkinson's have always been a special attraction to see what yoga can actually do apart from multiple sclerosis and other conditions. So as I was mentioning, why is it so important to bring in integrative neuro-rehabilitation? So this is where we are trying to bring in streams of medicine, not necessarily conventional medicine, but the common factor is everything should be evidence-based. And the main aim is to really empower an individual for innate healing. Okay, so then also we are looking at improving functional capacity, inducing mental relaxation, emotional stability, with the final goal of improving quality of life. The main objective is here to complement and to augment the beneficial effects of each of the systems. If you look at what is that we are interested to bring in under integrative medicine, where a lot of research is going on already, is of course the first line of therapies coming from modern medicine. But recent times, there's a lot of add-on therapies which have been brought in from Ayurveda, yoga therapy, naturopathy, acupuncture. Of course, physiotherapy acts as the first line of therapy after either surgical or medical intervention. And most important, beyond all this, is behavioral therapy and various other symptom-related management. But in recent times, robotics are making a big inway into neurorehabilitation, which has lots of benefits over conventional rehabilitation methods. Let me bring your attention on yoga therapy. What is that we are looking at bridging here? one common factor, apart from working on the major disease itself, is, as Dr. Praveen Thomas mentioned, as Dr. Sanjay referred, is there is a common autonomic dysfunction observed in all these individuals, featured by heightened sympathetic tone. Okay, so as if this is not enough, there is concomitant stress and anxiety complicating this recovery process in individuals going through that. Yoga works at both these levels. The first thing what anyone looks at using yoga as an intervention is bringing an autonomic balance. Okay, so if there is heightened sympathetic tone, the aim is to move this sympathovagal balance to vagal dominance. And of course, stress and anxiety have been very well shown that yoga can actually significantly reduce them. We also want to move from body-based therapies to mind-body therapies. That's what Dr. Sanjay was referring to through meditation and others. But yoga can bring this holistic perspective of working at both the levels. And there are at least little more than 80 publications in looking at how the mind-body connection is more important than just working at the body level. So I always looked at bringing yoga. The important reason behind bringing yoga is developing something called conscious intelligence in these rehabilitation individuals. Imagine these people, a stroke patient or anyone else who is left on the bed or on a wheelchair, is not taking that first initiative to make that movement in their muscle. So imagine the recent advancement in robotics have brought in artificial intelligence to pick that a trigger or a potential from a muscle to actually amplify and send it as a signal to the brain to understand that a muscle, an individual is trying to move his muscle. So now that's what can be much more significantly influenced through this yoga-based approach of bringing a conscious intelligence, because that's what yoga gives us. And of course, the whole purpose, as Dr. Praveen was talking, preventive approach. Prevention is not just in the beginning, but also even preventing further damage or preventing further worsening of a condition done through yoga. Finally, the goal is augmenting recovery. So an individual is recovering in 6 months, can we make it happen within 3 months by the intervention of adding yoga to other intervention? Just as a key takeaway, Dr. Sanjay has touched upon a lot of them. So yoga, as I mentioned, here what we are looking at, reducing heightened sympathetic tone. Here, the important components of yoga, which have been studied, for example, pranayama, 2 studies which we have done on stroke patients. One of them where we looked at pranayama, particularly adding short periods of sustained breath holding in along with uninostril yoga breathing, which showed a significant improvement in cortical blood flow in affected brain areas in these stroke patients, which was measured using functional near-infrared spectroscopy. So also we have done few studies looking at in the patients undergoing neuro-rehab, whether yoga can contribute in reducing inflammatory cytokines and stress biomarkers. Certainly, yes, these have demonstrated that it is very much possible to do that. And we are also looking at, are there any specific genetic pathways? Because Dr. Sanjay was talking about aging process. So we have done some studies looking at telomere length as well as telomerase activity. And a couple of other studies done already using yoga are all in agreement that yoga can increase the length of telomere, as well as yoga can facilitate slowing down the aging process. And of course, these common effects are very well known: anxiety, depression, stress, and its negative impact on recovery process. and finally with the goal of improving quality of life. More than any of this, what we aim at is empowering an individual to really take that initiative, motivate that individual so that he won't lose his heart and surrender to the condition, add confidence and add interest to his life, which brings in optimism. This is just some information for those who are really interested. I have picked these from various publications where people have used yoga-based activities in neuro-rehabilitation, something called Shitalikarana Vyayama, loosening practices, which are once again based on awareness and breathing, strengthening practices like Shakti Vikasaka Pranayama, exercises, progressive muscle relaxation as part of yoga and yoga nidra. Once again, it's a combination of multiple techniques. Sectional breathing, Vibhagiya Pranayama, is once again used in a couple of studies. Uninostril breathing or as well as alternate nostril breathing or Anuloma Viloma Pranayama has been effectively used in reducing stress, bringing autonomic balance in various publications related to rehab. And also, as I mentioned, a short period of intentional, it's not international, intentional breath holding, which is at the ratio of 4 counts of inhalation, 2 counts of breath holding inward, and 4 counts of exhalation have been shown to benefit these individuals. And certain other techniques, chronic energization and resonance-based and counseling related to yoga. So these are techniques for anybody who would like to take it up.
Yeah, if I may just intervene, it was, as you're saying, a lot of, different beneficial effects of yoga, and we need to explore and also tell, the public where as they're looking forward to different other, areas where they want to understand more about the implications of yoga. So as we understand, there are a number of neurological symptoms that could point to a possible problem. Say, for example, chronic neck pain, dizziness, frequent headaches, numbness or tingling, seizures, maybe sleep issues, vision problems, and many more. But for a common man, it's difficult to understand which specialty to go. So Dr. Manjunath has explained elaborately about the benefits of yoga in neuro-rehab. Thank you very much, Dr. Manjunath, for all the information you have shared. It was wonderful to know about the same. As we go ahead, we would just also pose some questions to the experts, because we have received a lot of questions. And as the first question, I would just like to ask Dr. Praveen to please take it up. One Mrs. Bharati Sharma has asked us, and she says that I have cervical pain and frozen shoulder. Should I visit an orthopedic doctor or a neurologist? So such questions and the answers you would give will really help people understand, what do I do? So Dr. Praveen?
Yeah, thank you, Mrs. Sharma, for that question. I mean, this is a question which is probably something which is not faced from patients as well, also from some doctors who I come across who really don't know who to refer to, especially if it's a GP, for instance, because it's all conditioning, cultural conditioning of, on certain levels, and how those patients have seen people do before, and how these doctors also have been practicing in their various cultures. So let me tell you from the perspective of a country which has got a very refined process in place, that is UK, for instance. So there, everyone knows their roles, and everyone keeps to this kind of a system where it doesn't really matter whether you have an extra patient or not. So for instance, whether you treat 20 patients or 100 patients, your pay is going to be the same. And moreover, if you treat a patient who you are not supposed to treat, it might go into an audit, and you could be, and this is applicable to Australia. This is applicable to most other developed countries. So what is happening is that in our country, specific to India, anyone can treat anything. And what is going to happen is that more number of patients you see, the more Is it basically in terms of if it's a practice based on a private practice scale, more numbers, it's again more lucrative, and so everyone will take up the patient. So I'm simplifying the question, who you should see. If it is from a referral from a GP, the base family doctor who sees you, who identifies this problem, and he thinks that this is probably something which is related to a frozen shoulder joint problem, then he is right in referring the patient to an orthopedician in the first place. But again, if the GP is trained enough to understand if this is not a joint problem per se, but the shoulder pain and the neck pain is due to migraine, as it's my next presentation actually on how migraine can present differently. Everyone thinks that migraine is just this headache, but this whole thing about including the neck, if that's the condition, then it's easy training basically. Once you empowered the person's medical students also, once the training comes in, they'll be able to identify, okay, this is related to a degenerative cervical joint pathology, or is it migraine, or is it something else? Similarly for the shoulder, if it's related to a nerve problem which is causing a problem within the joint, then again, you might be, the neurologist may be more comfortable in using neurological medications, whereas the orthopedician may be more inclined towards using short-term painkiller category of medications along with physiotherapy. So it all depends on who you're referring to. You go to a trustworthy person who is your family physician, for instance, who has been seeing you for general. That concept should come back, I guess, if it's not there, where families used to go to that. So it's just like they have so much of this thing and they trust, and also the clinician would immediately refer the patient to the correct doctor because they know who to refer to. So it's not the onus of responsibility is not on the patient, but it's on the doctor. And similarly in the UK also. So if you come to any specialist, if it's not his job, he will refer to the right person. And that's very important, rather than keep doing something to the patient and days, and the early intervention sometimes can make a difference. So people suffer because of this lack of a right pathway.
Right. Yeah, Dr. Praveen. So as you said, what the key is, probably visit your GP, and the GP is the right person who can guide you across. Thank you, Dr. Praveen. So as you were also mentioning about early diagnosis, in continuation, so if a person has tremors, what should he do, Dr. Sanjay? Are all types of tremors neurological in origin? Could you please elaborate?
Yeah, look, the tremor is the question, what you said, all the tremors are neurological. Yes, definitely, all the tremors are neurological because there is a tremor. Now, what is the cause of these tremors? They can be physiological, like almost everyone has experienced a tremor, when you're anxious, panicked, physically stressed or emotionally stressed, and the free hand, certain posture, everyone can have a mild tremor. So that's not unusual. But whether the tremor, what it means, again, it comes from the basic doctor whom you are seeing, family physician or a general practitioner, who should look and take a proper history. Tremors can be because of the drugs sometimes, like sodium valproate, amiodarone. People who are taking, bronchodilators, that can give rise to tremors. Patients who are on chronic alcohol withdrawal can give rise to tremors. So we have to look into all those things. We have to look into the family history. Sometimes they can be benign familial tremors, runs in families. Tremors can come with anxiety. Some people, in Australia, we have these VC exams, year 12 exams, and I see a lot of students coming with tremors in the hands. And, even I think Dr. Thomas might be seeing some young lads with headaches and migraines more during these, year 12 exams and whenever, stressful situations. So all these things needs to be, so a proper history is must in neurology. In neurology, you can't move forward without a history. And that history, the family physician can take history or a GP can take history. So once we know whether there's no drug, no family history, no stressful situation, it's not a physiological, and then it's the time for a neurologist to have a look what exactly the problem is. So not every tremor is Parkinson's, not every tremor is really something sinister, but one has to look into what type of tremor it is. Then there are various other ways by which you differentiate tremors, like rest tremors are seen in Parkinson's disease, action tremors are seen in benign essential tremor. It can be a cerebellar tremor, whether there are other accompaniments, whether there's a lesion in the brain. So we don't do brain scans in all patients with a tremor. You have to look into which type of patient. Common things needs to be ruled out first, like thyroid profile needs to be done. Even increased thyroid levels can give rise to tremors, and you have to take a drug history. So there are so many things which needs to be sorted out before you can label what type of tremor it is.
Right.
Thank
right.
you.
Yeah. Yes, Dr. Sanjay. So I think very well articulated. So here, since you're also mentioning about tremors in Parkinson's disease, can you also tell us more on why we should probably reduce the usage of drugs in Parkinson's disease, if it's okay to ask you this question, and what should we do to reduce medication?
Okay. Are we talking about Parkinson's medication or something else?
Parkinson's disease exclusively.
Okay. Look, the thing is, again, it comes to individual movement disorder specialist or a neurologist, how he treats his patients. I personally think that you start with a smaller dose and then you gradually go up if the lower doses are not working. It also depends on the age of the patient. Like, the young patients, we can start them on dopamine agonist drugs, while older patients, we go on a gold standard like levodopa therapies, which comes by various trade names in Australia like Cinemet, Medo, Parkinson. But in India, I know there are so many different names in dopa and all those things. So if you start on a bigger dose to start with, and I look, to be honest, I know the people who don't know what is Parkinson's disease. It's not just about a neurologist or a non-neurologist. Sometimes a neurologist is not seeing that many cases. They start on a standardized 3 tablets a day or even more. And that can give rise to very early dyskinesias in these patients because we are overshooting. So you have to understand a Parkinson's patient is having dopamine deficiency, and we are replenishing those lower levels by giving them oral levodopa therapy. Now, if you give too much, it will overshoot, and overshoot will cause, rather than slowness, it might cause fidgety movements. We call it dyskinesia. And to control dyskinesia, then some doctors who are not knowing what exactly it is, then they can a big problem. And I've seen patients subjected to deep brain stimulation and other advanced treatments.
So, Dr. Sanjay,
once you don't understand the physiology.
Yeah, Dr. Sanjay, do you agree if I
Yes,
just
go ahead, yes.
if I just kind of ask you or say that with intervention of yoga, can we really bring down the drug dosage and help better patient recovery?
Look, this is the strategy what I do. I give suboptimal level of levodopa to patients because I showed one of the slides, and deliberately there I wanted to mention this. In research studies, it's being found that meditation, yoga, it produces dopamine. Now, dopamine is a reward hormone. When you are happy, when you are not stressful, your dopamine levels goes up. So you have to rely more on your endogenous dopamine. So I give patients that they should be motivated. They should take their Parkinson's in their hands and try to do something with their body: exercise, activity, meditation, yoga, and mind-body therapies. They all increase dopamine levels. So rather than taking an external dopamine, why don't you increase your own dopamine levels? Use them and then supplement with a suboptimal dose of extra levodopa. That's the best strategy. And that's what I do. Now, while you're talking about yoga and Parkinson's, I want to mention that there are so many mind-body therapies which are effective in Parkinson's disease, like Tai Chi, Qigong, and yoga. And so at this stage, there are about 10 to 12 studies on yoga and Parkinson's disease. One of the studies published only 3 months back from Hong Kong was a really good study. There was a number of around 280 patients done in 3 different centers and randomized control in which they compared with the standardized exercise.
Yeah,
and they found that these patients did.
Yeah, thank you, Dr. Sanjay.
So what I'm trying to tell you is,
yeah. No, please go on. Yeah.
So anyway, so this is what the yoga.
Since we're talking about medication and how we can really bring in this component of people feeling that medication is the only option, many of them feel that as well, and they do not know that medication is not the only option. So Dr. Praveen, I would also request you to tell us a little more on, say, headaches like tension type headache, or be it migraine headache. So how can people use yoga to manage, and how can we really build awareness in them on the fact that medication is not the only option?
Yeah, so it's more of a lifestyle modification, which is beneficial for almost all diseases, isn't it? For prevention and also for slowing the progression of most diseases. The benefits of actually having this lifestyle modification, which includes proper food, proper exercise, proper sleep, everything comes into play. When it comes to exercise, with specifics, since you asked about migraines and tension type headaches, or any type of headaches for that matter, it's important to realize that in migraine, exercise during a migraine attack can worsen the migraine, any form of exertion. But what has been found in the studies so far is that it's brought a reduction over a period of time, not during the attacks, but it's overall the number of attacks have come down. So how does that happen? The same thing again, what Dr. Sanjay just said, that the kind of stress, inflammation, and those things, they all have a triggering factor to this cascade of chemicals which create this kind of problem in different networks in the brain. So if you reduce that by increasing a parasympathetic activity and reducing the sympathetic overdrive, that itself is reducing the stress to the extent that you can actually prevent an attack coming from.
Right.
So that way, exercises which are tuned to mainly benefit this vascular tone, or whatever we call as the autonomic nervous system, that will have its own benefits.
Right.
Plus the feel-good factors and the endorphins and enkephalins. And also for certain conditions like cluster headaches, again, hypothalamic, pituitary axis, they all been implicated. So if you look at that levels of disorders also, this kind of an involvement of the autonomic circuits can have potential benefits in reduction of these and cascade of chemicals.
Right. Yeah. Thank you, Dr. Praveen, for this great insight. So, Dr. Manjunath, since 12 to 15% of world literature comes from SVIASA, especially in the field of yoga research, and you being the director of research at SVIASA, I would also like to hear, and rather our audience would like to hear your perspective on using yoga therapy for different neurological disorders. If you can just summarize quickly in 1 or 2 minutes. Thank you.
Yeah, it's very important. See, today we talk about evidence-based approach. But what is important is, do we have, little more than 6,000 publications are there in yoga research as on today in PubMed. And out of which I'm happy to say that more than 650 publications have come from one university in India.
Wow.
Out of this. But what is important is, as Dr. Praveen was talking, Dr. Sanjay mentioned, the quality of publications, what the world will expect us to produce. Okay, how many of them are randomized controlled trials? How many of them are well blinded? How many of them have used those measurement tools which are acceptable world over? There are so many of them which are done in such short term with the short term interventions, like hardly 1 week, 15 days, 1 month, 2 months. When you're talking of degenerative disorders, the longitudinal studies are what we look at are lacking. We are really focusing on these areas at present, though we hold 12 to 15% of the world literature. We are really looking at what the world is expecting yoga researchers to produce. And what we are also doing is doing it as collaborative studies involving those experts, be it neurologists, and also bring in all those multidisciplinary people and make it as multi-centric studies involving various countries if possible. So, for example, UK, we very frequently collaborate. We have done a multi-centric trial with University of Nottingham on diabetes. So similarly, we are doing another study with a group of European countries for neuro-rehabilitation, particularly looking at multiple sclerosis. So in a short way to say, yoga research is actually taking a big leap in recent times. But I would say it is still in the stage of infancy when you look at the available literature in all of the fields of medicine. But that also gives us a lot of scope. Okay, so there are lots of studies which we can conceive and work on. And I think yoga and yoga therapy can be effectively used, and for which we need amazing evidence based on today's standards.
Yeah, thank you, Dr. Manjunath. So just moving ahead, one other aspect is stroke. So it's so common, common man understands it as a paralytic stroke or a paralysis. So early signs of stroke, very important to find out on it. So Dr. Praveen, how can people recognize them to avoid complications? Some tips which can go out to people.
This is a generic question which is not related to anything of yoga. It's just a general question which has come, isn't it?
Yes.
About how to identify a stroke. Okay, so
identify, or how can people really recognize so that they avoid complications, and some tips to them?
Yeah, so there are many simple things that call like the fast scale, fast response, looking at the facial deviation, arm drift, and speech problems. These are the things which are normally happening in strokes. But remember that many of them, what these symptoms are all, which happen in a person, need not be a stroke. So there are a lot of things called stroke mimics. So for example, migraine is a stroke mimic. Low blood sugar is a stroke mimic. Tumor can be a stroke mimic. There are so many other things which can mimic a stroke. But the first thing, so to make it more simple for a patient, you can say that if you have a deviation of this face and asymmetry of the face, like one side looks different from the other, there's drooping of the this mouth angle, this is something which is again which should then think about, and the patient should think that personally he's having a stroke. But commonest more than probably about almost the same is what we call as a simple condition called Bell's palsy, which can also produce this. And it's a disorder which is quite benign. You just take the treatment and it's not life-threatening or anything. It's a rare, complicated geniculate disorders. And otherwise, generally speaking, once the facial thing is, apart from that, is next spot to look at is the arm drift. So a simple test is to lift the arm and keep it there. And if you can just maintain that position, means your arm strength is good. But if it's kind of slowly drifting down, that means there is a betterment of weakness. So these are the things which even the paramedics are taught to quickly identify. Then there's a speech problem in the form of he can't understand, or he or she cannot understand what's being spoken, or the words that are coming out of that person is not clear. So these are speech problems. So this is some basic things about a stroke. Bear in mind that this alone is not enough to say that a person is having a stroke or not having a stroke. For example, there are very strokes which can just present with a hearing loss, sudden onset of hearing loss due to an auditory artery pathology. You can have a stroke which is affecting just the memory and the areas related to memory or even behavior. So they are not manifesting in the form of any weakness or paralysis. Generally speaking, stroke is, yes, these are the common things, but anything abnormal which is different from the baseline alerts the individual to go to a doctor and ask what's happening. Let's say a person is recurrently getting a one-sided numbness with headaches, and the doctor said this is migraine with an aura, with a sensory aura. So the next time also he gets the same thing. Every time he need not go to the casualty, get a CT scan or CSF study and all that. Once you understand this is a pattern thing, then you think, but anything which is a change in that pattern, again, means that you need to get an investigation. So if it's the same thing which is happening for the last 20, 30 years, as part of, let's say, a migraine problem, which is also can behave just like a stroke, then you need not be overly concerned.
Right. Yeah. Thank you. Thank you, Dr. Praveen. So, well, we understand that, in post-stroke recovery, a psychological component would probably play a crucial role in the recovery. Dr. Sanjay, since you see a lot of Parkinson's disease patients, motivating them probably is very crucial. Can you also tell us, how the same can be applicable in post-stroke intervention?
I think when you speak to patients with any degenerative disorder or even post-stroke, because it takes quite long for the recovery to take place, the first thing is acceptance, because stroke comes like a stroke. It is all of a sudden. So your life is fine. You were driving, you were eating, you were talking to family, and suddenly the one side of the body has gone hemiplegic, and now you are in hospital and then in rehab. So there's no time even for a person to understand what has happened to the body all of a sudden. And so in that situation, you can't motivate patients that quickly. They have to accept. So the first thing is that they are in sort of in a denial and shock and grief. And even up to 50% of these patients who had massive strokes, they can have depression. So we have to look into their psychological well-being. They need psychotherapy, they might need antidepressants, and they need sometimes counseling. And it's not just the patient, but also their caregivers, their family members, because it's a big burden on them. In countries like in India, where the problem is that rehab is not that really good structured rehab system. There are no aged care facilities to take care of that patient for next 3-4 months. All the burden comes to the family members. And the second thing is the physiotherapists, they are also not very trained in a particular specific domain. Like there are physiotherapists, but they might not be that good in just looking after the stroke patients. So all these things needs to be taken in consideration. And I think in that sense, when you talk about, maybe mind-body therapies, then I think you can add things like mindfulness or meditation, which can help patients to get adjusted to this new change, new behavior, new challenges. And then when you talk about yoga and stroke, look, I haven't really looked into any literature about that, but probably yoga can help with other things. But here we are targeting specific muscles, specific issues. So if any part of yoga can help in that part, then probably it is beneficial. But I think it should be done along with the ongoing standard physiotherapy and exercise program.
Yeah, true, very true. So maybe Dr. Manjunath can just quickly tell us how probably pranayama can be as good assistance in stroke recovery as a part, as a part and parcel of the regular rehabilitation process.
Yeah, as Dr. Sanjay said, what is more important is first of all put them on the conventional line of rehab and bring in pranayama as an adjuvant. Okay, so when you bring as an adjuvant, pranayama cannot be given just like what everybody thinks that you have to do yoga 1 hour a day kind of it in the morning. What otherwise a 1 hour of yoga can do. So also along with that, when you have pranayama, which can actually bring breathing. So the aim is once again to bring the breathing of an individual to as low as possible. So rest of it, you can have so many other different types of pranayamas which can help them. The main purpose is, number one, reduce the rate, and number two, make their
Yeah, I think Dr. Manjunath's video is slightly lagging. So just to go ahead, I think towards the fag end of our conversation. Am I audible?
Yes, Dr. Vasudha.
Yeah, thank you. Yeah. So fag end of the conversation, the interest is also to understand the post-COVID effects. It's being understood that COVID-19 virus probably affects the nervous system. So neurological complications appear to be more common in severe cases. But I would like to get a quick perspective from Dr. Praveen and Dr. Sanjay regarding the same.
Yeah, sure. Okay. So COVID neurology is, so if you remove the COVID from it, what you're left with is neurology. So it's a saying that COVID neurology is neurology. Almost every possible neurological conditions have now been linked to COVID because there is a direct or indirect evidence that yes, it may be a causal relationship, which is COVID exacerbating something. It could be an autoimmune problem. It could be headaches, migraines. It could be a stroke. It could be a venous thrombosis. So all this is somehow or the other related to the COVID pathology. And the mechanisms can be different. It's just that when on one level, it makes the blood thicker. On one level, it makes inflammation. And on another level, it produces antibodies and attacks the nervous system. So there are various methods of attacking the nervous system by the COVID virus. But I think what is more important from an integrative medicine point of view is what is really happening in terms of rehab, which is again what Dr. Manjunath was actually referring to in aiding recovery, and more importantly, about how the people in the lockdown and situations like this, jobless conditions, or people who don't know what exactly is going through an existential crisis situation, how much of their mental health can actually be. We see a lot of patients getting into the system because of worsening of their depression, anxieties, which have been there. So that's where again I think yoga can play a significant part. Yoga and pranayama, everything combined together to make sure that there's a balance and there's a systematic way of having the dinacharya, as they would say, to have it in a regular way rather than spending the day just sleeping or not doing anything and not having any hope about a good tomorrow. So I think yoga can be helpful from that point of view as well.
Right, yeah. Dr. Sanjay, would you like to add upon something to the same?
Look, I think the whole last few months is only on webinars on COVID with stroke, COVID with headache, COVID with Parkinson's. Everything is COVID, and the literature, if you see in any neurology journals, is full of COVID stuff now. Now, I would like to give some specific points about COVID. That one of them is that loss of sense of smell. And in Parkinson's disease, loss of sense of smell is almost the first thing, in Alzheimer's disease as well, in neurodegenerative conditions. So they are coming with hypothesis that it may lead to neurodegenerative brain disorders as a sequelae of COVID, because nobody knows what's going to happen after 5 years or 10 years. And whether the virus starts in the olfactory nerve and then goes up. So that's one of the things. So now, the clotting mechanisms, the young strokes have increased in America. There's a big flood of, and there were papers from the Stroke Society that there are a lot of young stroke patients. Now, one thing, the other important thing, which I think Dr. Thomas have already pointed out, which is very, very important, is that patients with neurological conditions or any conditions are now confined to their own homes. Like in Australia, we are having lockdown. So you're not allowed to have any physiotherapy. You can't meet people. You can't do group activities like hydrotherapy or physiotherapy. So they're confined to their homes. And this is increasing their anxiety. And, a lot of people who are having multiple comorbidities and diseases, they always have some sort of stress levels, anxiety and depression, which is getting worse. So now what we have done is, like for my patients, I take twice a week of yoga classes with them on Zoom. So I think all these technologies can definitely help people to engage with each other, to still do exercises through Zoom classes or through telehealth. And even patients, we are seeing patients through telehealth now rather than face to face, because Parkinson's, most of these patients are elderly patients, and we don't want them to be exposed to, meeting doctors, coming into the hospital. So all these technologies are quite useful, and I think these technologies are not going away. I think now we have found, like right now we are doing this webinar. Otherwise, I would have to travel to India to do this. This is the COVID times invention.
Yes, absolutely. I
Very,
fully
very,
agree.
very true. Very true.
I hope
Yes.
I hope it stays, because you can save so much of expenses in unnecessary
Expenses, travel time, and lot more. Yeah, family
Exactly.
time. Those who are
Exactly.
traveling are losing family time. Yes, yes.
Absolutely.
So, yeah. I mean, just to add upon, SVASA is also doing a lot of work in the post-COVID rehab. So, Dr. Manjunath, would you quickly sum up that in a minute or two?
No, I think Dr. Praveen as well as Dr. Sanjay have brought in the same points what we are trying to add with yoga as an intervention. See, the attempt is just to very straightforward. The objectives are very two. Number one, how you can actually improve the respiratory endurance, and how you can make an individual respiratory system succumb to the viral load. Number two is definitely to improve the immunity, and how yoga can do it. So many studies are there. What we have done is certain specialized practices which are very well known. People use it otherwise. One is a deep abdominal breathing. So if you do diaphragmatic breathing, abdominal breathing, it is shown to increase the oxygen saturation. Even if you do it for as shorter a period as 3 minutes, it can increase it in individual. We have done it in elderly population, 3 to 4%. So then we have tested it in COVID patients in a small group. And we have also tried giving thing like Jalaneti, which is also used as a nasal cleansing method using saline, lukewarm saline water. And also we have used steam inhalation as one of the tools to actually augment this process of recovery for the individuals who are suffering from it. So pranayama is very, very important in these people. Number two is add few things which can help you prevent further progression of it. Post-COVID rehab is a very wide open topic for discussion. I limit it, leave it here, because we are understanding which are the systems which are going to get long-term influence and effect, and how do we rehabilitate them. So certainly yoga can have a role to play, but we have a very open space to consider when you talk of post-COVID rehab.
Thank you very much. Yeah, please. Yeah.
Yeah, quick question, Dr. Manjunath. Just forgive my ignorance. When I understand that Kapalabhati is a type of an abdominal respiration. So I've noticed that after Kapalabhati, when you have this hyperventilation, multiple deep breaths which are going out and you exhale, after a while, when you stop it, you don't have to breathe for a few seconds, in the sense that you can just stay there. So the physiological understanding is like this: when you have a hyperventilation, it washes away the carbon, it washes away the oxygen level, basically. So when you have, it actually, yeah, exactly, it washes away that carbon dioxide, and the stimulus to take a breath is basically based on that level of that drive to maintain the respiratory drive. So have you done something like an ABG or something post exercise to see what's the level of all these carbon dioxide, washouts and things like that, and does that really help? Because there's no respiratory drive for some time, you see. That's what my concern is, really.
No, you are right, Dr. Praveen, because one of the hypotheses behind what we call it as an automatic cessation of breath for fractions of seconds after Kapalabhati is attributed to washing of carbon dioxide. And as we all know, carbon dioxide is a very high potent stimulant for this cycle of respiration, whether you want to really initiate it or you want to stop it. So Kapalabhati induces that for sure. But what we are looking at is a couple of studies where we looked at what exactly happens when you do Kapalabhati versus any other technique, and be it simple fast breathing or even standard hyperventilation. We also have techniques like Bastrika. In Kapalabhati, it is only active exhalation, passive inhalation, while Bastrika has active inhalation and exhalation, which actually takes an individual very quite similar situation to as that of hyperventilation. Right. So these changes, chemical changes, have been very well noticed. And you are right, Kapalabhati actually induces that stage because of active exhalation, where you are throwing out the carbon dioxide more effectively than taking more oxygen inside. Good,
yeah, and increases the dead space as well, I guess, in terms of the compliance, lung compliance, and all that is very useful.
Very true, very true.
Yeah.
So, anyway, overall, we definitely see pulmonary functions and varied other physiological functions which do, improve when yoga is administered. So, I mean, the post-COVID note was essential because we are in the COVID era presently, and we would like to disseminate the knowledge to the people watching to know more. So I think with this, we come to end of the program. But yes, VHG being a service provider, we have also now just launched or launching it tomorrow, the post-COVID rehabilitation program, which is going to be Ayurveda and yoga therapy based, where we are planning to have very specific consultation with doctors and then lead the person towards better recovery. So we also suggest everybody watching to also check on our informative posts on FB, on Insta, and different other social media platforms. So thank you all doctors for having been here. We have also had a little bit of extension today. I think we are 20 minutes beyond 6 o'clock already. Dr. Sanjay, it's very late for you. My apologies for keeping you awake this late, but I think you should take some additional nap tomorrow morning of 1 hour, if it is
happens
feasible.
When you invite me, It's a
not at
common
all.
So 15 minutes
thank
of
you,
extra
Dr.
meditation for him.
Oh, thank you.
Anyway, thank you, Dr. Ravi. Thanks, Dr. Sanjay, and thank you, Dr. Manjunath. Namaste. And,
Namaste to all of you. Thank you very much.
The Shanti mantra, as we usually do.
Yeah.
Sarve bhavantu sukhinah, sarve santu niramayah, sarve bhadrani pashyantu, ma kashchit dukkha bhag bhavet. We pray for peace, peace, peace everywhere. Pray for universal peace. Thank you very much. Look forward to meeting you all once again. Namaste.
Thank you. Thank you, Dr.
Thank you. Thanks, everyone. Lovely meeting all of you.